Good evening, ladies and gentlemen, and welcome to yet another great episode of Bahrain Now, your source of local initiatives, happenings, talents, and trends. I'm your host, Lara Sam'an, here to walk you through our exciting lineup of segments and personalities from around Bahrain. So don't go away, we'll be right back. Shahrazad Ali Murad, a Bahraini woman who is dedicated in the holistic lifestyle coaching, is here to talk to us more about this new coaching approach and how does it affect an individual's life. Welcome Shahrazad to the studio today.
Thank you.
So, introduce yourself to us. Who is Shahrazad?
Okay, Shahrazad. I'm a holistic lifestyle practitioner and a jewelry designer.
Okay, so two complete different things, or do they have something combined within?
The combination, I mean, they complement each other, and I think because I'm passionate about both, I couldn't segregate them.
Okay, which is nicer. So you put it like, okay, I like this and I like this,
Exactly.
Let's put it together. And can you tell us, how did you choose holistic coaching?
I've always had an interest into, health and well-being, and also art. I mean, I did the academic route. I graduated from computer science. I did my MBA.
So completely different.
Exactly. I was in the employment sector, but again, when I started my family, it was very hard to balance between, family and doing the 9-to-5 job. So it was on the last day of my Hajj pilgrimage, where, it was it's like a new chapter in my life. I was Googling and thinking what to do next. So I came across, this field. And I decided to do it. So I did holistic health, I did psychology of eating, I did essential oil coaching. I finished all the courses, and then I started practicing.
Okay.
So I did that for a few years, and then I thought, okay, I need to,
add something to it.
Exactly, move on, add something to it. So again, it was itching at the back of my mind. I mean, I'm good in art, why don't I do something with art? And especially that I'm very interested into, crystal healing and gems and their properties. So this is how I combined it.
And what would you say is holistic coaching?
Holistic coaching is looking at the body as a whole, and not segregating the physical aspect, the spiritual aspect, the nutrition aspect, just looking at the system as a whole.
Okay.
Yeah.
And did you find that holistic coaching in general has something to do with the well-being of somebody?
Definitely. If you're lacking in some area, it's going to affect another area in your body.
Okay.
So we have to look at the body as a whole and, target. If you're not doing well physically, let's see, where does the problem stem from?
Okay.
Are you not doing enough exercises? If you have, for example, digestive issues, is it what you're eating? Is it stress related? So
there's many different things.
Exactly,
between
very
it.
comprehensive.
Okay, amazing, amazing. Okay, and you design jewelry, of course. Can you tell us about the jewelry that you design?
Yeah, I started around 2 years ago with Corona.
With Corona, okay.
Corona. I had a lot of time. But meanwhile, I was doing courses, of course, with Danat. I was flying to Dubai and doing courses as well in design and gemology and just different
gemology is, I'm sure, very interesting.
Very,
and I feel like it has something to do with holistic healing as well.
It does.
Can be part of it.
It does.
Okay.
So I thought I'm going to design something, because I'm a very minimalistic, simple person. An elevated jewelry, but very simple for the modern girl.
Okay.
So all my designs are very simple, but they have a touch. It's either I've added nice gems to it or calligraphy.
Okay.
So you can, wear it during the day.
It can be
events.
all the time.
Exactly. It's not bulky and it's not very, very simple. It has a touch.
Okay, where would you say you get your inspirations from for your jewelry?
I get my inspiration from my surroundings, from music, from scents, from traveling. I mean, anything can inspire me.
Anything can inspire you. Okay,
yeah.
and it makes you want to just design something.
Yes.
Okay, can you tell us actually more about the jewelry you've bought with you today?
Yeah, I bought the jewelry, and I bought some stones and crystals that I either source locally, like the mother of pearl and pearls, Or when I travel, I try to grab whatever I can. So this is, for example, is Amazonite. I love this.
It's a beautiful stone.
Yeah, the color is amazing.
The color is amazing.
Yeah, yeah. And this is smoky quartz.
What would you say is your favorite stone from all of these stones that you've actually bought with you today?
I like turquoise a lot. I like it a lot.
I feel like that's a lot of
it's a protection stone, yeah.
Okay, a lot of people love turquoise.
Yeah, yeah, yeah. And then I think the second would be, you know, rose quartz, and it's the stone of love.
It's beautiful.
Yeah, it helps, you know, healing heartbreak, and, you know, helps with the forgiveness. It has a lot of properties. But I also love pearls. I mean, definitely we grew up with pearls.
All of us grew up with pearls around us. And of course, a Bahraini pearl.
And it has a lot of properties. It helps balancing the body. It helps balancing the hormones, the water levels in the body. So it's amazing.
It's amazing.
Yeah.
I'm guessing each stone has a different benefit.
Yeah.
Can you tell us what are the benefits?
So I mentioned a few. Citrine, for example, it helps with goal setting.
Okay.
So, you know, if you're procrastinating and you don't know when to start,
you should have something that has a stone in it.
Exactly.
Okay.
Exactly.
Okay.
And for example, Amazonite, which is amazing, it helps with creativity and flow. So it's great for singers, for writers, anyone creative.
Okay, and how would you say, if somebody wanted to wear one of these stones, what do you recommend is the best way to wear it, either in a bracelet or an
There is
earring?
no preference. I love wearing them as rings usually.
Okay.
Yeah, but
rings. That's what I see them. It's always rings.
Because I can see it. That's why.
Okay. Yeah. So it's always on your hand. Every time you look, there's a ring on your hand, which I find. So the holistic coaching that you do, of course, and then the jewelry making you do, all has like
they complement each other.
They complement each other, exactly. And of course, that now I'm guessing is your full-time passion.
It is, and let's see what comes up next.
What are your future plans?
I mean, I'm doing organic skincare formulation. I'm studying this now.
Okay, amazing.
So I have, you know, a goal to maybe release someday my skincare line one day.
Okay, which is amazing.
Yeah. Inshallah.
Inshallah, you never know, of course. And with your holistic coaching and the jewelry and then the skincare, of course, and I'm sure that you can add parts of these stones to
definitely
to the skincare, because I always read things now that has
because I mean stones have, you know, their own vibrations, and we consist of atoms. Atoms have vibrations, so you need to resonate with the right gem. And like you said, you can add them to skincare, you can add them to your water. You know, have you seen those bottles with gems?
Yes, at the bottom there is the water bottle right now. It's a glass water bottle, and it has a full rose quartz in it. Yeah. Okay, so that of course helps the person as well.
Definitely.
Okay, before we end our segment, I wanted to ask you, what's your favorite piece of jewelry that you've designed? That's your personal favorite.
Personally, I love mother of pearls.
Okay.
Yeah, so I don't know. The reflections are amazing, and you can wear them two ways. You can, now this is the elevated look, but you can also remove the mother of pearl and
then just wear it.
Very casual.
Wear it as a nice earring. Okay, that's amazing. That's amazing. Yeah. That's amazing. Thank you, Shahrazad, for this beautiful segment today.
Thank you for this interview.
I'm very excited for your skincare. Hopefully we'll get to try it soon.
Thank you.
Viewers, don't go away. We'll be right back. Tonight in the studio we have Dr. Marat from King Hamad Hospital, who will be talking to us about cancer awareness and prevention. Hello, doctor, and welcome to our studio today.
Thank you. Thank you for having me.
So can you tell us, doctor, what are the common diseases between Bahraini women?
So we see in Bahrain most common cases such endometriosis or the uterine fibroids, the polycystic ovarian syndrome. And between the cancers, the breast cancer and the uterus and the ovarian cancers are most common
common in Bahrain.
And keeping us quite busy with them.
Okay, wow, there's a lot that are most common right now in Bahrain.
When we compare it with the general international standards, we are not lower than them.
Oh, okay, so we're actually almost on the same level of
Same level, by some of them we are higher than expected.
And can you say that we're up to date with therapies in Bahrain right now?
Yes, we are quite providing up-to-date treatment options, and recently in any diseases, any kind of procedure, diagnostic and treatments available in Bahrain.
Okay, amazing. Which is a good thing for Bahrain that we're up to date, like almost
It
with the
is.
world. Yeah, and of course, every year we're getting more and more up to date with all the.
Yeah, we have quite good colleagues on the market who are dealing with all of this.
Okay, which is, I find that amazing. Hopefully, we'll be one of the best in the Gulf or in the region.
Well,
And could you tell us, why is keyhole surgery? Why should that be a choice?
it is not something new. It is existing since many, many years, decades, but having advantages when we compare it with open surgeries. So it is about the recovery time. It is about the complication, less complications. It is about the minimal access and the scar size. And so far, it is less bleeding surgery. So when we put all of them together, having a lot advantages, and so that who don't want undergo a surgery and in 2-3 days is recovered and isn't turned back to
2-3
normal
days.
life. Yes, in general.
Okay, and would you say that, would you use the keyhole surgery as the most choice for people? Like, would you recommend that the most?
Yes. More than 25 years, yeah, but so far I can say 90% of my procedures are minimal invasive, call it laparoscopic surgery.
Okay,
yes.
amazing. So I'm sure all of your patients are happy with the scarring because it's very small compared to open surgery like you mentioned. And can you tell us, doctor, are there prevention possibility cancers for women?
Yes, we have, especially in women cancers. We have disease such cervix cancer, the Arabic call it the anchorine cancer. So it is a preventive disease, but requires proper screening from staging, starting with the early ages and continue. We know that the cause of it, for example, is the HPV virus. And when we detect the HPV virus, we have a special management about it. So if we know it, then we can prevent it. If woman is regular with these exams and screenings about it, then yes,
we can
prevention for sure we can do that.
Early prevention. I was going to ask you, what are the screenings for women who have cancer, and when should they do the screening tests?
So we have depends on the organ, different kind of screenings. With the breast, starting with age 30 with yearly ultrasound, and after age 35 starting to increase the ultrasound with yearly twice, which is harmless, the ultrasound.
Of course.
For mammogram, waiting age 40 or 45.
Not earlier.
No, mammogram
no.
not.
Okay.
There was studies. In America was doing the mammograms from age 40 with yearly, and in Germany after age 45 with 2 yearly distances. There was 1.4% more cancers related to the irradiation from the mammogram.
Wow.
So, but there are conditions which we have to start early as well. And if it's a genetic disposed woman, then we are starting with age 20, 25 with MRIs and such screenings. If it comes to the other parts, the uterus and the ovaries are followed with gynecological exams and ultrasounds, and yearly twice with 6 month distances is the recommended way. But about the cervix, there was the preventive part as well. So the cervix then is the main screening of it is the pap smear test.
Yeah.
So after marriage, you should start 2 years later. But in general, so far age is 25 latest to start, and need to add on it every 5 years the HPV screening to the pap smear, and every 2 years pap smear testing. Because if HPV comes positive and the pap smear follow it with a proper management, then patient can be then prevented from a cervix cancer as well.
Okay.
So
best way for early prevention as well.
Yeah.
Okay.
So out of breast, ovary, and uterus, cervix, we don't have other organs for women. You know?
Okay.
We are following them mainly.
Yeah, you're following them mainly. But it's okay. So there are ways to do early prevention. It's just people have to make sure that they do the correct test. Make sure you start at an early age and not leave it too late where you never know at the end of the day.
We have even the vaccinations. So especially for the cervix cancer, after age 12, when we vaccinate the girls,
Okay.
then we can reach 99% prevention,
Okay.
yeah, vaccination about the cervix cancer. But after marriage and after then getting the HPV, usage of the vaccination is there, but the effectiveness is not 99% as should
anymore,
be.
yeah.
But still it helps. So we have the vaccinations, which should be even considered for age 12, 14 before marriage, so that our girls are vaccinated, so then we can do something good for them.
Which is amazing. I never knew that there was a vaccine for this to help with early prevention as well, and 99% help it be prevented in general.
Yeah.
That's something, yeah, I never knew this.
Yeah, about
Yeah.
cervix cancer.
Yeah.
In Germany, we have it almost as a rule.
Okay, that you have
so
to
there
take
are
it.
some countries, they are vaccinating age 10, age 12, 14 regular about this HPV, which is the cervix prevention. And,
Yeah.
and there are countries like Australia, New Zealand, and America, Canada. They reach it, even Germany, they reach it within 10 years, 50% reduction of the cancers with this
Okay,
way.
okay, with this simple vaccine.
Yes.
Okay, so hopefully worldwide one day it might be a must, so we can prevent it more and more for all the girls in the world. Hopefully.
Yeah, even
never
if
know.
not must, we have it in our hand. and
Yeah, so
can
we
use
have it
for our
available
family
for whoever.
members anytime.
Yeah, okay, which is amazing as well. That's something new
Yeah.
that people, of course, not everybody knows this, which is a
Yes.
good thing to look into.
Yeah.
And can you tell us, doctor, what is endometriosis and is it curable?
Yeah, this is a chronic burden. It is worldwide affecting a lot of women. So by 2 of 10 women having very, very severe burden about it. The main problem about it is the chronic pain, which starts with the period time and starting to go slowly in the daily life. So endometriosis, Arabic call it Untitled Chapter. So is the intrauterine line cells, they go out of the uterus and implanting
Okay.
in the body, like in the ovary, intra-abdominal line, or in the abdominal organs. But very, very rare, even sometimes it's in the lung, it's in the brain, but this is
wow.
extremely rare.
This is very
conditions.
rare.
Yeah.
Okay, yeah.
And so far, if is it managed early, can be help to the woman. We don't have yet any certain treatment where we say, okay, after the treatment, now cure is
You're
there.
cured, yeah.
Because we have even after the procedures or after the treatment, 20% relapse risk. So the main golden standard of the treatment is the surgery, surgical removal of the endometriotic hairs. And we use mainly the minimal invasive, the laparoscopic surgeries and procedures for it. There are even some options like medications or hormones use of, depends on the severity of the burden.
Okay, okay, so there isn't actually a way to treat it. It's just like you said, you can minimize it. It won't fully leave you.
We remove it,
Okay.
but it comes back. So before, there was theories how it's developing.
Yeah.
So long time we had some theories. The most of the accepted one was that the intrauterine line cells goes through the tubes and implanting, but we couldn't explain how is it implanting in the lung or in the
Yeah,
brain.
because how
So
can that
then
happen?
we landed the last decade in the stem cell theory. So now it is a problem which is during the stem cell life happening. So the stem cells are the reason for this happening. So
Okay.
and then imagine every month woman having the period bleeding. So wherever is the implant thinking is inside in uterus trying to bleed and leaving scars, and each month with the new scars, pain going more and more.
Wow, okay, so it can be very painful as well.
Oh yes,
Yes.
it is. There are chronic patients, they are really suffering under this pain, and they need really a big amount of painkillers to
What
use.
would you say are symptoms for people to understand if they have this?
Mainly, the main problem is the pain. So yeah, the pain, but first starts with the period
Proper
time.
pain.
The pain starts a couple of days before period and the period time. And each 6 months slowly starting to go to the daily life.
Okay.
So if it was before, for example, 2 days before period, and then 4 days, 5 days, 6 days.
Okay, just
There are
keeps going
women
longer
now,
and
because
longer.
of the burden, they have chronic, everyday the pain. So, and, but if the endometriosis is inside in the intrauterine line, we call it adenomyosis, then in this situation they experiencing then even heavy period bleedings,
Okay.
but even causing bloated feeling or frequency urination
Yeah.
or back pain,
Pain, yeah.
or pain radiating to the legs. So mainly we are dealing there with the pain.
Okay, so it's something that just continues becoming more and more and more, and that's, of course, then you
Yeah.
need to go get it checked just in case.
Right.
And can you tell us, doctor, are the cancer treatments limited, or is there alternative cancer treatments or therapies available?
Yeah, we have the conventional treatments, which are the surgery, irradiation, and chemotherapy.
Of course.
But there are even call it integrative, complementary, and immune oncology. So, which is the last couple of years now starting to be highlighting in the cancer patient life, where the immune system is mainly supported and used to fight with the cancer.
Of course.
So this kind of treatments are called the integrative and complementary cancer treatments. Recently in GCC and in our country, we don't have the options. Usually the patients traveling abroad for it. I hope one day this will come as well.
Hopefully we'll
So
have
then
this here. Yeah.
it is a completing part of the cancer therapies, which is supporting the patients under cancer treatment, or patients who not having option, or patients don't want the conventional, or patients very old, and because the integrative complementary treatments, they are mainly less side effect treatments. With the immune oncology, there are now even very, very good achievements reached, and very, very good talks and clinics are running with the treatment options as well.
Okay, so there are various treatments that people
Yes.
can look at,
Yes.
of course.
Yes.
Not only, of course, you have to go through the radiation and the chemo and everything, but there are other ways to help them as well, cure the cancer.
They have to go through that way, but in the same time, using this kind of treatments, it's helping to achieve the success much more.
I get what you're saying. It helps it make it just better. It might as well, like you said, the immune system being strong needs to be there, of course, because the body, the chemicals start to bring down the body more and more, and you have to fight it, of course.
Right.
Yes.
Right.
Is there anything else, doctor, you'd like to add before we end the segment today?
Thank you at first for this informative day. So far, the important part is regular visit of the physicians and getting the regular plan for your lifetime, so that when there are certain things which can be prevented, then we can do it in the right time, to better than to be late.
Yes, early prevention is the best.
Yes.
Thank you, Dr. Murad.
Thank you very much. Thank you.
Take care of yourselves and talk to your doctor. Stay tuned. We'll be right back. Beautiful jewelry line by a young Bahraini designer who specialized in jewelry designing speaks to us about her inspiration and passion in the making of the details of her unique jewelry. With us in the studio, Aisha Mohammed, the creative director of Aisha Jewels. Hello Aisha, and welcome to studio.
Ahlan, thank you so much. I'm really happy to be here.
Welcome to our studio. And tell us, Aisha, how did you start designing jewelry?
Whenever someone asks us to speak about our story, I always say that things in business happen so gradually that it's very difficult to pinpoint the exact start and end of a stage. However, for jewelry design, I do have an exact date, or at least an exact year.
An exact date?
Yeah. Yeah, I started in 2014.
Okay.
It was part of a mandatory high school project I had.
Okay.
So yeah, that's how I started.
Amazing. So whoever the teacher gave you this project to do must be very proud of you right now.
I thank her so much. I thank her every day.
Yeah, because from the project, it made you then continue.
Exactly. When I first started the project, I did not have, I did not have that in mind. I did not think I'm going to continue. But when I saw the look at people's faces when they saw the designs and the prototypes and they tried them on, I was like, you know what? I want to continue seeing this look for the rest of my life.
Okay. Did you study jewelry?
No, I studied fashion design.
Okay. It sounds a little bit
related, yeah.
Kind of related, but okay. But still not jewelry designing.
No.
So it's completely different. And what would you say is your unique signature? What is Aisha's unique signature?
So I think it's something that evolves with you as a designer. The last thing you want as a designer is to be one-dimensional. So if I'm going to think about it, I think some of the things that we're known for is integrating untraditional material in our jewelry. For example, using wood in our high-end artistic pieces.
Okay.
Another thing would be asymmetrical designs, which drives my goldsmith crazy, by the way.
Of course, because it's really hard. Asymmetrical designs are like so delicate, and they have to like try to make them so perfect. So I feel like he's like, please don't do this.
Yeah, and the thing that drives him crazy the most is designs that can be worn in more than one way.
Okay. Okay. So it makes it more complicated for him.
Yes.
Okay. And what would you say are your inspirations?
I feel like inspiration doesn't have to necessarily be at something that's tangible. If you look at our designs, you'd feel like they represent different parts of me, different emotions, and you'd see a little of me in each of every design.
Okay, you put your own little touch into each design.
Exactly, they reflect different parts of my personality, my background, and the things I'm interested in.
Okay, and would you say that there's a story behind each design that you do, or almost each design that you do?
Even if there wasn't a direct story, there is always a story in the process of creating it or manufacturing it. So there's always something to say.
Yeah, there's always something behind. If someone says, oh, so how did you make this? I'm sure that you always can tell them something.
Exactly, there's always some small touches here and there that have a tell-worthy story to it.
Okay, okay, I like how you said that. That is very true. And how would you say that Aisha Jewels is different from other jewelry companies?
So the jewelry market is as old as mankind, and a lot of people would say that it's really saturated, and it's true to a certain extent.
It's very saturated. I agree.
But the market is continuously looking for designs that are different, a new perspective, and I feel like there's a lot of local designers that come up with this new perspective or this new outlook to things, and I think we're very proud to be one of those.
Okay, which is amazing, and of course it's being locally made.
Yes,
makes it
everything
even
is made in
special.
Bahrain, handmade.
Okay, everything is handmade.
Everything is handmade.
Okay, that's why you're saying your jewelry smith wants to
kill me,
really
basically,
happy.
yes.
Yes, he wants to basically
He wants my head.
Yeah. But which makes it more unique as well, that it's all handmade here in Bahrain.
Of course, every piece has a specific touch to it. Even if we want to recreate the exact same piece again, it's really impossible.
Okay, so every piece is different from each other. Okay, and can you tell us what is the process of designing? How do you guys start it?
So when it comes to a specific design, for example, there is no eureka moment to it. It's constant hard work, and you have to go back and forth between your thoughts, your research, your manufacturing techniques, but the end result is definitely worth it.
Okay, okay. And would you say that you've designed something that on paper to you it's like, yes, this can be made, but then at the end of it, it was like, okay, no, it cannot be made because it was a bit too complicated?
Yes and no, especially when I first started, this was a constant struggle.
Of course.
But with, when time passed and with experience, I feel like خلاص, this problem doesn't really come anymore because you know your boundaries.
Yeah, you know now where you can, what you can and can't do.
And with experience, you learn lots of techniques of how to overcome these things. You think of ways you can, creative solutions to things. When you first start, you don't know what you can do. But with confidence and with experience, you're like, you know what, I think I can think of something that I can do about this.
Yeah, and it's more of a trial and error part as well.
Exactly, definitely.
Yeah, especially like you said, that you just started from the project. So it's like, okay, I don't know what I'm doing in the beginning, and let me just keep trying and trying and trying. Now look where you've reached today.
Thank you.
Can you tell us, Aisha, where can we find your jewelry?
So the short answer is through our outlets. But we are very active on Instagram with a bit over 70,000 followers.
Okay.
Through our by appointment design studio and through our virtual platform, which is our e-commerce website.
Okay. And what would you say are current projects you guys are working on right now?
So we're working on a lot of things. A lot of them are kept as a surprise for our friends and followers. But one of the most prominent things that we're working on is upgrading our virtual experience. It's something different. Definitely not something I've seen in the region. So we're very excited about that.
Hopefully launching soon?
Very soon.
Okay,
very soon.
okay. Yeah. That's good. Hopefully launching soon. Okay.
Inshallah.
Yeah, inshallah. And is there anything Aisha you'd like to tell us before we end the segment today?
Well, we're in Jewelry Arabia next month, so
everybody pass by. Oh, I'll see you there. I will be passing by. Yes,
that's great. That's great.
I will come see you. Thank you, Aisha. Hopefully one day from a project I can design something myself.
Inshallah, why not?
Yeah, I might pass by you guys and see that as well.
Inshallah.
Thank you,
We'd love
Aisha.
to have you there. Thank you so much. Thank you.
Thank you. Ladies and gentlemen, stay tuned as we'll be right back for more. Well, ladies and gentlemen, we've made it to the finish line, and a huge thank you to all of our guests for joining us tonight, and another huge thank you to all of you watching us at home. As always, be sure to reach out to us on our social media accounts shown below. We love hearing from you. This was Lara Sam'an. Until next time, good night and God bless.